o'clock. And I would like us to look at our screen and observe the slides while we give 5 more minutes to those on the way to join us. In the meantime, those who are on site at Bugolobi, the weather is very good, bright, no rain, and plenty of cool air to enjoy. So kindly bear with us 2-3 more minutes and we get our numbers to 15. Then we'll go for blast. Good morning, ladies and gentlemen, all our distinguished guests this morning, fellow participants. You are most welcome to this morning's hybrid session. Today we gather here to explore a topic that affects the lives of many and is of great importance. The topic is living with stroke, a caregiver's perspective. I'm delighted to see many among you who have been with us in our previous sessions, discussions related to different health topics, such as high blood pressure in older adults. This was expertly given by Dr. Javira. We had a hybrid session with seniors doing exercise and learning what exercises are good for them. And then we had several sessions on mental health for seniors. This morning, we are honored to have Mr. and Mrs. E.S. Mungati to take us through, to share with us what they've gone through as a caregiver to a stroke survivor. Mrs. Joyce Mungati is our main presenter this morning. Joyce, would you like to say good morning to the participants?
Good morning, ladies and gentlemen. I want to correct my names are Agnes Joyce K. Mungati. Agnes.
Thank you very much, Joyce, for that correction. She is a UK trained nurse and a lady who has worked in many places, including a special place called Luzira Prison. A remarkable individual with impressive background and is so ready to share her insight. And she has truly lived with someone with stroke. We will hear all about that. Her extensive experience and that will undoubtedly provide distinct perspective on the health care for this particular topic.
What advice would you give as a patient?
She's a loving mother, a grandmother, and she recently celebrated 50 years of marriage to Edward. And this is an extraordinary achievement. I must add that she carries her years with grace and vitality, looking half her age and very so bright this morning. That's a top up for you, Joyce. Later this morning, Edward himself will share words with us because he is living. He had a stroke some time ago, and he's going to share with us. It is our hope as Purposeful Aging that this discussion will shed light on the challenges faced by stroke survivors and their families and provide valuable insight into how we can better support the patients who have had stroke and the whole family at large. Let's take the most let's make the most of this opportunity to learn and grow together. This session, as usual, is going to be interactive. You are free to put up your hand when you feel you need to come in, and also put comments and questions in the chat room. And we'll have a session of Q&A towards the end of the session. Yes, we are now ready to have Joyce to share with us. You're welcome, Joyce.
Hello, good morning all. Let's have a moment of prayer before we start. Father God, we ask you to lead us, be with us as you have been with us in this disease, which started 9 years ago in our family, and you have never left us since then. Lead us as we prepare to share with others our experience, which we have gone through, so that what we have to say is useful to those who will hear. I've prayed in the name of our Father God. Amen. 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 I want to correct, my names are Agnes, Joyce K. Mungati. And most people know me as Agnes. Even my certificates have Agnes as my name. So people who know me in a different way call me Joyce, and I'm not blaming anyone. I'm grateful to be here, and I'm thankful and really, really grateful to the organizers of these meetings, starting with my mama, Dr. Christina Kadama. For us, she's our mother because her husband, Patrick, is the father since her father died. So thank you, Christine, and your team. And I didn't know, when I'm home, I didn't know that this is something which involves the whole family, because I'm here at home with them. I'm seeing everyone involved. Even those who don't sleep here have come here early with their children to see that they organize this meeting, the machines to be able to work and get to us and to you wherever you are. So I'm grateful to you all. And I also want to give you thanks for making this not just this topic of today, but the whole thing as you started it, the rightful name, you've said it, for the aging. It has helped us, especially throughout the COVID days when we were home. It was a lot of education to all of us wherever we were. And I'm glad Dr. Christine has mentioned Dr. Javira's topic about high blood pressure, because when I'm going to start about our stroke and its effect and whatever happened and what is happening now, I look back to the talk of Dr. Javira. It was very, very, very helpful to us. And from that time, I noted that it is never going to be too late to learn. He talked about the salt, he talked about the diet, he talked about the sleep, he talked about the exercise, he talked about many things. The good thing is we have records of all the teachings which have taken place. So anyone can order or go back and listen to them. Today, mine is living with a stroke, a caretaker's perspective. And it came to us in the old age because I was just calculating, and then I realized that my husband, when he got it in 2014, It was a Saturday, 14th of October. I'll never forget that day. It was the day which changed our life. He was 79 by then, but he was living a normal life as a human being would live. He was driving himself. He was going to work. He was going out in the field, doing his work. He would go safaris. He would go, if you send him, please, on your way back, stop at a certain place and pick this for me. He would do it. But then all this changed one day. And that change affected many of us. All of us as a family, it affected us. And it affected even friends and the community. I include the community because I have seen as he continues to live, there is nowhere we go where they don't recognize that he has got a weakness. They would either leave a chair for him or give him a hand to cross a road or give him a hand to sit down. People are always ready, so everybody is involved in this disease. So when we listen to the teachings, it is not only for the old, it is for those caretakers who may be young, who may be old, who may fall victims, and the like. And following what I was given, I have talked about the introduction of how it came about and how long we've lived with it and the changes it brought. Because all these changes happened all at a sudden. Someone who was doing his duties, that day was a Saturday. I was supposed to go to a wedding, but that day he kept going back to his veranda and keeping there. He was on his phone, but he told me he was not well that day and he didn't go out. And I was supposed to go to a wedding. I didn't even go. I said, let me just stay around. I'm saying all these little details because later on, I'll tell you when I'm giving tips why I'm saying all those things. Because if I had been more careful, I would have maybe arrested the situation before it happened. But deep in the night, he crept out of the bed, went to the bathroom, and he never came back. And when I woke up, I looked for him, and he was lying flat in the bathroom. It was a terrible sight. And he said, I need help. I need help. Please, I want to get up. I could not get him up. I realized he was weak. He could not get up. I opened the outside door because we live two of us in the house and called the helper. And the boy came in quickly and helped me. By then he was all wet. Everything had changed so much. We changed him, we put him back to bed. I started communicating to the relatives and friends and the medical personnel. Good enough, we are blessed with the team of medical personnel that whenever something happens, they are quick to make that chain. They inform and until the right person is informed. And then we were taken for admission. He was admitted to a hospital of choice at that time on Buganda Road. And we spent some days there. Things changed and the whole family had to be involved. You don't have to ask. It is just obvious because I couldn't manage taking care of him day and night. So the whole family, they all mobilized themselves, those who would be around during the day, those who would be around during the night, and they did it. In the first days, there were 2 at a time, and then eventually 1 person at a time. All this was because he could not move. He had weakness on his left side of the body. He could not walk properly. He could not talk properly. He could not eat properly. He could not chew properly. He could not swallow properly. Everything was improper. And so we needed a lot of help. And then I would be around only during the day. And then one of our sons, he went straight and bought a ticket for a relative who lives in California to come straight away. He's a doctor, to work with the medical team here. I'm talking all this with tears behind my eyes because I see the love which we don't experience when we are okay. We don't see many people. But when we are sick, you can really see people pouring in. And it is good to do it when the person can still see. So that doctor also arrived and worked together with the doctors here, and he flew back. And these people had meetings every day, this family, our family, with our family doctor, family friends. And they used to have meetings. How are we going to manage this patient? What is the next stage? And they would see the doctors in turns, and they would get a feedback and know what to prepare. And we had to prepare properly the home where this kind of a patient was going to be. This home had to have many changes. A friend of mine, or two, suggested a room which has more light, which is easier to get to the toilet, which is nearer. You don't have to pass through the corridor to get there. You go straight to get there. And so we prepared that bed because it was even a higher bed. And so when we were preparing for home, we prepared a bed which was suitable for him. And they even we were told he will need a walker. As we were there, a walker was ordered. It came when we were still in hospital. Then one of a relative, a very close relative, ordered a very nice walking stick, which he's very proud of. He still has it. It also came, it was a special order. Then our son, who had paid the ticket for the doctor to come from California, arranged with a certain restaurant in Kololo to give us someone to come and go through the menu in the hospital which they want their dad to be taking, so that that person could be preparing the meals which are special, because those are special orders from the doctor. The meals according to the patient, he can't chew, he can't swallow properly, so he needed special soft meals, and all that was done. It was a lot of expense going through this, and then we had to do exercise. Exercise when we are still in the hospital, they'll bring the right people to help him, to assist him, and even when we were discharged, we went to physiotherapy. And there is a specialist, we call him a special physiotherapist. He lives very far out of Kampala. You take that road going to Bugerere, you pass through Gayaza. I've forgotten the place, but he's very far, and a lot of humps. And my patient preferred that person once he went there, because in between we had tried to bring people to do physio at home, but he preferred the hands of that gentleman. So we always drove there, but he got tired and stopped. And that I have to mention it, we stopped a bit early than it was recommended. We have just started again this year because my husband is still leaping. My husband is not leaping is part of not walking well, the memory loss, and all those things which disturb someone who has a stroke come to him very frequently. And now as he has grown a bit older, I think those things have increased. And also something happened when we were in the days of COVID, that he got a severe heart attack. A severe heart attack when we were in complete lockdown, no cars moving, and this was at night, 9 p.m. Our son had to travel from Bugolobi to get to Ntinda. Our daughter had to get from somewhere with 2 grandchildren to come and take him to hospital. In the morning, they said this was a serious heart failure. And whenever we have gone, whenever they take the heart X-ray or the special X-rays for the heart, they see the seriousness of that heart problem which occurred. And I'm saying all this because when we are managing our patient, when we are discharged, we were given rules. Observe this. His bladder, that is very important because incontinence and, the bed has to be dry all the time. It has to be changed all the time. Diapers, if necessary, and so on. And I've mentioned the heart because the things which were mentioned that to us as we are being discharged, that observations have to be made so that we prevent occurrences of further damage to his organs and his body. If you don't eat properly, if you don't do this properly, but sometimes I think we relaxed a bit and some things went beyond our control. And then we ended up with a very serious heart failure. Since then, he has been even weaker, his memory loss and all that. The drugs are many, which he's on, and we have to make regular checkups. And it is good to make those regular checkups because before we used to buy medicines from the counter, from the pharmacy, taking the medical form. Here in Uganda, they agree to do that. But when we leave the doctor and the doctor says 2 months, come back, that's what we do. But before, we would pass through that, even take a year without going back to the doctor. As long as we are taking the right medicines, we relax because we had no problems. Things were moving well. This affected us all because it was a big change to the patient as well as me, the closest to him. And during that time when we were discharged, the children, they knew a close relative in Mitiana who had a very good nurse. So they looked for that nurse and they brought him, and he stayed with us for some months until the patient got better. And it helped us a lot. And me, myself, I have gone through it. It isn't that we have gone through it, but we have got used to it, that we even make jokes about the things which go on in our life, in our everyday life, because there are a lot of fun going on. Things are forgotten here and there. What is said is forgotten if it is not noted, and all this and that. But we have to be helpful to each other. I have to give tips to caretakers. Caretakers, this one is not at the time when the person falls sick. It is a caution to all of us. When we live in a home as a family, we have to have an understanding family. Every day we have to have an understanding family. It is part of God's orders. It is part of love. Not to pretend we need to care. I have to say that because that Saturday, when he got this stroke at night, he told me in the day that he was not well. He was on his phones on the veranda. I was on my duties in the kitchen. I didn't bother what was happening. If I had taken the blood pressure machine and checked, I would have known straight away the pressure had changed. But because I knew he is living his own life, I'm living my own life. We need unity when we are together in home. We need caring for each other. We need to do it faithfully, and we have to do it. That one, I feel that it is the thing which would bring you to good nursing, to good aftercare. When the person feels sick, you wouldn't say, but after all, no, you do it with a good heart. So let's do that. And also, I found that my blood pressure was also starting to go up, and I needed help. And so I also started going back to the doctors for regular checkups. And now what we do when he's going, I also go. And I also take care of myself. I don't take the walks I used to take very far away in the village. I would walk up to very far places when I was walking those days. But now I just walk around the home because I know when I'm needed, I'm not so far away. There are things I'm not doing anymore. I can't just do safari as I used to. To say there is a seminar, I get on a bus, I get on a plane, and I go and I sleep there. I just have to assess the situation at home because it is duty. We have a nurse, full-time nurse now again, since the heart failure in 2020. And you can't leave them alone. We all need each other. And that is how I see myself moving. I'm taking care of myself. I also take exercise. I try to eat the right food so that I'm doing the right thing to remain fit. I don't know if I'm within the time. Am I okay? Or is that it?
You're very okay. You're very okay. Yeah.
I want
You
to
can
end.
share more.
I want to end by, I wrote a little something here. We read every day. We have been drawn more to God. We have had families come to see us, church people coming to see us. We used to be all saints people, but now we go to St. Luke Ntinda, and St. Luke Ntinda comes to check on us, and we are grateful to all the people who come to check on us, friends and relatives. And this being sick also has made me realize that doing this work, I couldn't have remained strong and done it well if God wasn't around there. There are days when I really felt very, very weak. I needed the friends, and I have two particular friends who have never left me. I won't mention the names, but they are here, and I'm grateful for your advice, for your being with us all the time. And God has been the best friend that I have ever had. I've had a reading on my head, which I said, how will I end this? And I said, let me end it in a summary. It says, this is Ephesians 4, 22 to 24. And it goes like this: let us remove old ways of life that are not pleasing to God and replace them with new ones. I've said this because at the time when we fell sick, we were full of vigor, we were youthful, although we are in our 70s. Our behaviors were so youthful, driving left and right. But the change which has come about has brought us peace. Thank you so much for letting me share.
Wow, 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 wow. Joyce, this has been wonderful experience you've shared with us. I'm sure we need some time to digest this. And in the meantime, I would like to ask you to make sure Edward is ready to contribute. And we take comments and questions, more sharing after he has given us a word. Dear participants, I think you will agree with me that most of the time, many of us see patients in the hospital, and little do we know, or do we even take in consideration the care which follows those you discharge from hospitals. She has ably given us, painted a picture for us. It's the patient, it's the caregiver, it's the community, it's everything around. And the changes are very, very fast. I will not preempt your comments and questions. I would like now to have Mr. Mungati coming on and share with us so that we can comment during one session.
Thank
Good
you.
morning.
Good morning. Thank you.
How are you today?
I'm fine. Praise God.
Praise
I am
God.
awake.
Yes.
And I am listening. I remember those days.
Yes.
They were very hard, very difficult. But with the help of God, we went through it. And God is still enabling me to go through those bad times. I remember when it was so bad that I had to fly to South Africa. I never knew I would come back, but God was with me. I came back. And as my wife has said,
yes,
God helped us in many ways, and He is still guiding us what to do. And I've got my doctor here in Uganda, Dr. Rwavi. He's very good. He has helped me a lot.
Yes.
And I look at him as my child, and he recognizes me as his father. So I've been very good hands of the doctor and friends who come and see me and give me encouragement. Now, if I go back to the time when I had the stroke, I was feeling very well. And I was on the veranda making several telephones to my friends. And I was very active with my work. I was going on safaris and doing a lot of work, both in my village, my father's children, to my brothers, who were relying on me for their life. And when this came, breathing was not easy, talking, I couldn't talk properly. I felt dead for some days, but if I didn't have a wife as good as Joyce, Agnes, I don't know what I would have done, because she did a lot work, a lot of assistance, and during that week of the stroke, I was completely helpless. Without her, I couldn't eat, I couldn't walk, I couldn't talk. But slowly, I have picked up, although my memory is still bad, but eventually I remember what I had forgotten, and even with the people, when I see a person, I take time to realize who that person is, but eventually I remember. And I remember after some time. That's the only problem I have. As she said, the doctors said that I should not have too much water around my heart. So that's what I try to avoid. And each time I see a specialist, they tell me something, don't eat this, don't eat this. I at times think, won't I eat anything? Because I'm told, don't eat this, don't eat this, and there's almost nothing left for me to be allowed to eat. But I am okay. With the help of the doctors, both here in Uganda and in America, they look after me, they give me good advice, and I'm okay. Not as strong as I was, but I've got enough energy to carry me around and do the work around. Not too much work, but reasonable. I thank God for all this, because all my friends are not there anymore. So God is still keeping me, and with my doctors, we are going forward. For how many more years, I don't know, but I hope for several years. Thank you. That's all I can say.
Thank you very much, Edward. It's been a very, very touching sharing. I'm sure members are all touched. Eyes are opened. Things we've been taking for granted are being brought out very, very clearly, that they do play a large part in the lives of someone who has undergone a stroke and those around the person and the community at large. I would like to open this session for any comments, additions, queries from you, the participants. We are happy we are so many online. Please feel free to share experience. At 42, we have some members present. I don't know if you want to start with us who are live here, or we give you a chance to throw in a question. But I think there is a question in the chat or a comment. Dr. Philippa, do you have anything to share?
There's a request for Mrs. Mungati to give some tips for caregivers to make things easier for them at home. Any tips that you can share?
Thank you. Thank you for that question. I thought I touched the tips, but maybe I was very brief about it since I started with love first. Love first, because we have to love what we do, you know, have the compassion, you know, to care full-heartedly. We have to love what we are doing, not to leave it to people who are hired to work, but to work together with them. But tips about preparing a home, you remove all the carpets if necessary. We were told to remove them. In fact, we have a doctor who came, a friend of the children. He's one of our sons, actually. He came from America with a special walking stick for Mr. Mungati that he would balance better. And he was showing him how to walk. And he said, even this little carpet in the house, you have to move it. And then you have to be careful about the steps. He gets out of the house through the back in the beginning when he's still using the walker, because the steps are not easy for him. And Mr. Mungati easily falls. He has fallen so many times, even walking in the compound. So he should have always someone close to him, not someone who is walking with the phone, attending to the phone, but attending to the patient to watch his steps, because he easily falls. And we are so lucky that he has never broke his bones, except he had one fall in January the 1st, and that one hurt him very, very much. And that's why he's still going for physio. The tips, love is the main thing. And of course, going by the doctor's orders. Doctor's orders are many. Sometimes we don't fulfill them. Sometimes when we feel better, we leave them. But it is good to bear in mind what the doctor's rules are. Low salt in the food, that topic has been here. Dr. Javida expanded on high blood pressure. Very, very well. It was very useful for us who have the high blood pressure, who don't have. It was very useful for us. I don't know if I've touched, but we must always have the right food. We must follow the right, not only food, exercise, someone to help this person to bathe, because he can't bathe himself. Mr. Mungati can't bathe himself. He can't dress himself. And by the way, I didn't realize that he doesn't know the buttons are in front. If you leave him a shirt, the buttons will be at the back. So someone must be there always to assist that person. They need help.
Seem to summarize it very well for all of us. You initially talked of changes and sudden changes. So I think the biggest tip we can carry away is that, yes, changes have come and we have to accept that and start living with the changes. You can't stay in the mode of Edward is able to drive, Edward is able to do this. That is no more. And you simply fall in line with what has changed. If you don't oppose the changes, you get improvement on those changes. You get used to living with the changes. The example you've given of steps, initially he could not go, he couldn't use the steps. But now I've seen him use the steps. I've seen him joining in activities. He, in fact, is one of the stroke people who have suffered the stroke, but has remained with a very high spirit. You remember when we went to plant trees and he was physically planting trees in the garden, challenging the youngest grandchild who would do the planting first. I also liked the love for the stick. You know, you bring a nice stick for him and uplift his mental status, change the rooms in the house, you know. Those are the tips, but I think when she listed them, we sort of took it for granted. It takes time to think of this bathroom. I had a bathroom like this. Now I have to turn it into that. I think that's the kind of thing, the tips we are picking from your sharing. Dr. Philippa, do we have any more?
Yes, there's a word of encouragement from someone, and he's saying it's good that that he thanks God for the palliative care and emotional support provided, and this strengthens the patient, and the patient doesn't feel abandoned or isolated. And another thing can be encouragement of the patient in some kind of activities. Of course, not all, but like you mentioned, the tree planting and having a way to involve them in all the other activities that the family is taking part in.
I remember at the beginning of these sessions of purposeful aging, we tried to encourage each other to have sharing in our communities. For example, my community is Bugolovi, to identify people of the age group, and we have like an evening or an afternoon of sharing. You do learn a lot and you uplift people's mental status. They don't stay between four walls the whole day, the whole month, the whole year. That's why we actually encourage these hybrid sessions. And we have sort of nucleus for people, wherever you are, you should start up a nucleus club for purposeful aging. And we keep visiting each other, learning from one another. At present, we have got a picture of someone who is in an urban area, but you can imagine my mother back home in Mityana, the state of the house, the changes one has to do is quite different from what we've had. But it is us, the caregivers, who have to, visualize and actually actualize the changes we need as caregivers. I would like so much if there's anyone else who would like to share experience to raise their hands, and we see if the sharing we can get from each other this morning. Dr. Philippa, anyone? Okay.
A comment from another comment that came in asking, I've heard of a few cases of stroke patients that were treated and actually recovered. But what is the real cost of such treatment in this country? That was a comment, but I'd say that recovery for stroke patients is very varied. It will depend on the time the patient presents to the hospital. If you go in early, your chances of complete recovery are higher, but also it depends on the health of the patient before the stroke happened. And the cost is something that will be hard to quantify, I think, and it will depend a lot on what post-stroke complications the patient has and their needs after the stroke. So it will be hard for you to put a figure to that, really, because recovery takes a very long time, and it really depends on the individual. So you can't have, I think it will be hard to put a single cost to this one. Then there's another comment of importance is positive attitude for both the patient, the family, and other caregivers, as in this case, in the case of Mr. Mungati. They have taken the changes in life, adapted appropriately while keeping God in the picture. That is a comment. And then another one, what is your advice, Agnes, to us in terms of diet to avoid stroke as we age? What should we eat and what should we not eat?
Thank you. That diet is very, very important. In fact, when we were in hospital, they brought a specialist in diet. And we sat, and she sat with us, the family, a few members of the family, and wrote a long list of things which he's allowed to eat and things, whatever he's allowed to eat, in minimum, not in big quantities. And I'm not going to give the diet because they talk about carbohydrates, not so high. Those are the posho, those are the rice, the matoke has a bit of that, carbohydrate also. Carbohydrates, as you know, and the food varieties and the proteins and the vitamins, to be more on the vegetable than on the carbohydrates. But doctors don't generalize all patients' diet. They go according to age and according to where you are, the state you are in. So our case was a patient who couldn't chew well, a patient couldn't eat much, and I'm sure even the digestive system was poor. So we were given the long list, and we have it, and we practice it. But he has his choice. He has stuck to a choice nowadays that one day if he eats matoke, the next day he will eat potatoes. The next day potatoes, next day matoke. He doesn't like this variety of foods. But when we are really going through the measures which we have, and we even have the measures is either the palm or the little cup, which we were advised here in these lectures we get here. We were told what the measures should be, and they are useful to be followed. But I'm not going to say this food is the proper food or this, but it is nice to have a balanced diet, especially to have a good breakfast and then have lunch and not have late dinner. I mean, not late supper, to have something light in the evening. But I think it depends person to person. I'm sorry about if I haven't answered it properly.
Thank you very much for the advice on diet. I will encourage everyone to look back on our previous sessions. We had doctors who advised on diabetes, on high blood pressure, on nutrition, on exercise, and generally even mental health, because the eating also gets affected. Appetite gets affected. We combine all this and move with what really works for the family. There's one clip, I think, which happened this week on X. Is it X something these days? Where Kavushenga said what was also said at one time in our sessions by Ronald Mukasa, that we invest heavily in health as at the ages of 35, 40. When you make your money, invest it in health, in your good health, so that when you age up to 60 and 70, you have good health. Kabushenga said that he works. He used to work when he was in his 30s and then run. And at that time, he would just spend money to buy a good canvas shoe and a few t-shirts. Sometimes he would even use these bonus t-shirts you get at functions, like a Rotary this, and you get a shirt, a t-shirt. So he would run every day, investing in health, so that his aim was that when he becomes 65, he will have a straight back and will be in good health. Exercise, nutrition, as we age, these are the biggest investments we have to make. And I hope members who are below 50 are taking note of these sessions. Many of you are in employment like engineers, structural engineers, design engineers. Look at our houses. What type of house do you advise people to construct? I construct when I'm about 40, and yet I want to live in this house at 70 when I retire. Can you please take all these things in mind? This is purposeful aging. You don't want me to construct a storied house with no racks and whatever, bathrooms which you climb into, yet at 70, I need to walk into the bathroom. So just like diet, there is no one correct food to eat, but you eat with intentions of, you know, the purpose of this food is for energy. You need so much energy at this age. and you need so much energy at this, when you are at this age. So your diet has to be tailored to your age and purpose. And so should every move you do. Invest in health. This is purposeful aging. Things you take for granted, like what she told us, that you are a husband and wife in a house, and you are both independent adults. You choose what to do, but what you do actually affects the person you live with in the house. So invest the love and the care in everyday activities as you age. And what you do, the grandchildren and the children are observing, and you can be assured they will invest the same things. So there you have 2 or 3 generations covered. I hope for those of you who at home have your children around and listening in at one point or another. Yeah. Dr. Philippa, do you have any comments still? Anyone who has a comment?
Yes, there are a number of comments thanking Mrs. Mungati and the family for the care they've given to Mr. Mungati and the good work that they have put in that. Yes, most of them are really comments around that. There was also a request for the previous session, so we've put a link for that in the chat for those who haven't looked at them. There are sessions we had in 2022 and earlier part of 2023, which you can access using the links in the chat and listen at your leisure. There's a comment about a tip for carers to always identify who the patient is comfortable with in things like dressing up, bathing him or her, so that they can do the activities with ease, because it makes them uncomfortable if they are with someone they are not comfortable being around. There was a comment about what pressure should one get scared that he can get a stroke. For this, I think would advise that we listen into the session. It was a 2022 session, I forget the month, on hypertension. It might have been May. I think it's a May session in 2022 in the link that we've put in the chat. You can look through that session and listen in more about the hypertension and how to monitor that. But also I'd like to add to this that strokes are caused by many different things and not just high blood pressure. So you're at risk if you have pressure, if you have high cholesterol, if you have diabetes, if you have a heart issues, heart arrhythmias, if you have a family history of a stroke. Even if you've had a stroke before, you're more likely to get a stroke. If you have a poor diet, so many things can put you at risk of a stroke. So we shouldn't only focus on the pressure and forget the other things that can cause a stroke. We need to look out for all the other things as well. Let me just check 2 new comments here. Okay, very enlightening talk. Thank you for your authenticity as you gave the talk. Investment in health is the message they've got. There are alternative devices or therapies that aid with maintenance of health, restoration, and regeneration. I wonder if this participant could throw more light on that. You can unmute and speak more to these alternatives that they are suggesting that can help with maintenance of health, restoration, and regeneration. I can't see the participant's name, but if you can unmute and speak more about this for the rest to be able to learn. Okay, that's it so far.
My name is Ronnie. I'm a former classmate of Dr. Christina Kadama. I think I would prefer to discuss this first with Dr. Philpa and Dr. especially Dr. Christina. Then they will see how to incorporate it in this. But the therapy deals with terahertz and quantum physics of the matter. It's almost it can be accessed from all parts of the world. That's what I would prefer to say at the moment. I've approached some of the people on this platform with it, but it's very good. Let me also add here that our health starts failing once we hit 20. So we shouldn't wait for later years to, our cells start degenerating very fast from age 20, whatever gender, but especially the female gender. Thank you so much, if that is okay.
Thank you very much for your contribution. I have put in the chat I'm going to post it, our email, for you to get in touch, and we can see how to discuss this more. There you go. Right. I see 2 new comments. How does one manage young victim with stroke? Do you want to talk a bit about that?
I don't have the name. And you are right. Young children get stroke from sickle cell, from anything actually. And we also have other conditions like fracture in a 70-year-old person. It may be like a fracture, mere fracture of a bone, but the consequences are as bad as or even worse than a stroke. So I will say at present, we are not prepared to ready enough to give you good information specifically for the young. This was an experience session for the aged, but the care, the love, the tips which have been given for caregivers will be the same. The medical side of it, we are not dealing with it right now. Sorry about maybe that's lack of preparedness for the young, but I guess the care, which is the most important post-stroke, will not be different. Thank you.
Yeah, that's right. I think the care for the tips will be the same, will be largely the same as what we've had for the elderly, and maybe more love for the young ones. There's another comment which is interesting about housing, and it's from Agnes. She says, we have been building our modern homes based on Western standards and Western lifestyles, whereby the elderly are then moved in homes or assisted living. But it's about time that we evaluate, sorry, I just lost that. It's about time we evaluate our African lifestyles and aging in the African setting and plan for this in advance, given that we do not have government systems in place for us. So as you said earlier, as we build, we need to put in mind that we are aging. and have a plan for that.
It's very important. Some of us who grew up in the villages, we had latrines, not even VIP, but just ordinary pit latrine. And you squat. It's a very good exercise, a very good way of extracting the whatever you need to put in the latrine. But when we moved to these urban European houses, then they made us sit in a position which doesn't encourage the excretion. And nowadays they have started putting toilet seats with stools that actually put you into a squatting position, which is good for the movement. Yet in the villages, people were now adapting to get a stool to sit, you know, to put on the pit, and they look like they're in sitting positions. I've found many ladies, when they have arthritis, it becomes impossible to squat. You know, we tend to have a lot of fat on our thighs, and squatting can be a very, very big exercise. So they have now gone into sitting position, which is not very favorable for that exercise. I think the middle ground would be to have reasonable weight and squat sitting position. Very difficult. But right, we need to work around with the designer, the planners for our house, the bathrooms. You realize Edward went to ease himself and was stuck in the bathroom. We can't even say how long that was. We don't know the position he was in. So these bathrooms and the structure of our houses really, really need to be rethought. Some of us enjoyed saving money in construction by not leveling the ground, and we ended up with stairs and is it called a slab? A stair and a slab. So the house is in many stages. You need a lift. We can't afford a lift. So I think, I hope there are engineers on this forum now. We have a long way to go in construction of our dwellings. Yes, Dr. Philippa, we look like one to close.
Yes, there's just one last comment I'll read out. To hear from the patient and the immediate caretaker is such a breakthrough. As a family, we thank the Lord for answering our prayers. I think that's it. There's no other question or comment. Back to you, moderator.
My Joyce is going to say a very small word to you, dear participants, dear caregivers, and those aging purposefully.
Thank you. I've enjoyed it more than I've ever enjoyed anything else. It's been a long session for us. Thank you so much for giving me this opportunity to say bye to you. I said bye with the word from the book of God, but also from the mature way of talking to you all. I haven't known who is attending, but I'm glad to hear your comments. It means we have a variety of people from different angles. I want to say a family means more than people you were born with. You have realized when I was talking about the people who helped us, they didn't have to come from the same home. So let's value one another. Let's give God his right place. Money will never take the place of God, so that we continue in unity, no fighting. We need a healthy community to take care of the elderly, because our elderly don't go to nursing homes. They stay at home. Keep visiting us, keep checking on us, and we enjoy your passing by if you do. I'm not specifically saying this to anyone. I'm saying to anyone who comes from a family. We are a big family. In Uganda, it is almost like one family. We need one another. Let's be different people who hear these teachings. Be different whether you're on the bus, be different on the train, be different when you're on a taxi, be different when you're in the church, be different when you have had these talks which are here. They bring love. Thank you.
So, Agnes, I have Nakanwaj here. She just wants to send a word or two to her friends. Thank you so much, Nakanwaj, for coming and joining us. Have we lost? Yeah, so Nakanwaj, thank you for coming.
Thank you so much, our invited. I'm glad to be here today. I think it is my first time, but unfortunately, I have not seen my fellow members on the presser chat. We have missed a lot, but I have enjoyed this program. Thank you, doctors, for inviting us. I managed to be here, but I passed through problems to reach here from Namgong to this place, but at least my son managed to bring me here, but yeah. And I'm encouraging the members, when you get invitation like this, don't miss this opportunity. It's very interesting and enjoyable. Thanks so much.
You're welcome. Thank you, members, for coming and for joining on Zoom. Our next session, I think, let me pass it on again to Dr. Philippa to explain to us our next session. Otherwise, we are always here on the last Saturday of the month at 10 a.m. online. And if we have a special hybrid session, we warn you well in advance. Dr. Philippa, please wind up and thank the presenters today for the session. Thank you.
Moderator, first I will thank Mr. and Mrs. Mungati and the family for accepting our invite to come and share with us. It's not very easy to be vulnerable, but we are very grateful that you accepted and came and shared with us some tips on how it has been with for you in this journey of managing at home when someone has had a stroke. We've had very many comments in the chat where people are grateful for what you have shared. And I'm sure that we have learned a thing or two that will be useful to others who are on the same journey. It's not easy. Every day is a new day. And we learn something every day. We never stop learning. Right. Our next session will be on the
Dr. Philippa, you are muted.
Hello? I hope you can hear me.
We can hear you.
Okay. Right. So our next session will be on digestive issues. I'm not sure if you had the thank you, but I earlier gave a thank you to Mr. and Mrs. Mungati and the family for sharing with us. And I was now currently speaking about our next session, which will be on the 30th of September at 10 a.m. It will be a virtual session, and our focus will be digestive issues as we age, most especially constipation, which is a symptom that several seniors struggle with. And we'll be listening to one of our doctors talking about how to handle this, what causes it, and how to deal with it as we age. Thank you.
Thank you so much for coming, for listening in, and the contribution. We are very, very grateful for your presence and useful comments. We shall see you again on 30th September. Today's was for August, so 30th September we are together. Thank you and bye. Be blessed always.